So we are now in Sowa Rigpa Wellness Center in Kathmandu, Nepal. Kuzang, please tell me, what is it, Sowa Rigpa Wellness Center?
So first of all, to start with, Sowa Rigpa Wellness Center is started under the light of Dr. Nida. So here we mainly focused on upholding the therapeutic and the treatment methods from Sowa Rigpa. So basically what all the Sowa Rigpa clinics are doing is everyone is doing pulse diagnosis, urine diagnosis, medication. But Sowa Rigpa Wellness Center, we mainly focus on doing treatments, the external therapies, and the therapeutic methods of the Tibetan medicine.
Okay, so mostly you are doing here diagnosis, of course, and later giving pills and give advice about diet, lifestyle, and external therapies. What kind of external therapies we can find here?
So here we mainly focus on Ku-Nye as of now, because Ku-Nye, it disappeared once. So Dr. Nida revived it, and now we are mainly focusing on upholding the Ku-Nye, and we are giving courses on Ku-Nye to Western people so that they understand.
Ku-Nye, it's massage.
Yes, Ku-Nye is a Tibetan way of massage. So we are kind of promoting Ku-Nye in Nepal as of now.
Okay, so people from the west, east, from everywhere can come here and study Ku-Nye.
So yeah, every people, we don't discriminate among any ethnic group or any kind of people. Whoever is interested in learning Tibetan massage can come and learn Tibetan massage with us.
So Sowa Rigpa is mostly known as traditional medical system. So basically, literally, Sowa means to heal, to cure, or mostly known as treatment. And Rigpa is the science or the knowledge.
Okay, could you explain some more how it's going in Sowa Rigpa? What is different between Western medicine and Sowa Rigpa?
So it's different from Western medicine in the sense we talk about the cause of disorder in a little bit different way. So we link it with Buddhism a lot. So we say the cause of all the disorders, and we relate it as a suffering as the ignorance. So which is way, way different from the Western medicines. And I would also say it's the way we also kind of go through the holistic. We were in the case of treatment, we also talk about the mental, like we say psychosomatic, where we will try to link through your psychological issues with the physical issues as well.
Ah, okay. So, but where we can find Sowa Rigpa?
I would say in ancient time, it's mostly practiced over the Himalayan regions, Asian cultures like Mongolia, Himalayan regions like Nepal, Tibet, India, and even in ancient times, a certain part of Bulgaria of Russia, if I'm not wrong.
Ah.
So now you can find it almost everywhere, and in the present time, so it's almost getting and seeking attention and getting attention from all over the places and countries, especially the European and Western countries as well. So I would say you will find it everywhere in this world.
So we are now in Kathmandu in Nepal.
Mm-hmm.
So why Sowa Rigpa is here in Nepal?
Yeah. So as we were talking about the connection or the link between the Buddhism and Sowa Rigpa, so the history of the Sowa Rigpa also follows the same thing. So we have this saying where in Gyushi, which is the main book of Sowa Rigpa.
Gyushi.
Yeah, Gyushi. Okay. It's called Fourth Tantra. So it tells about there are certain knowledge of the main knowledge of Sowa Rigpa where it was taught in certain places. Let's say the idea and the knowledge of compounding medicines are taught more in India. And then the urine diagnosis and pulse diagnosis are taught in Tibet. And similarly, Tholpo is the largest district of Nepal. And in that district, there is a saying that the venesection part, which is one of the major external therapies practiced in Sowa Rigpa, is taught over here. And along with prevalence of Buddhism in Nepal, so it came to here. And also it's about how free is Nepal, about it's always called like multicultural, multilingual and all these things. So it's they have the practitioner of Sowa Rigpa have this freedom to practice over here and compare to other countries. They don't have to like really go through strict rules and laws and all these things. So
Okay.
I think that also.
So because
is a
Nepal is a place between China and India, it's like Bhutan from many sides. So all connections coming here, like we are in the middle. So the same is like Sowa Rigpa, I think that it's between Chinese medicine and Ayurveda. Could you say something? It's some difference or similars?
Definitely, Nepal has a very, very, very good like neighboring countries. Yeah, and that can be a point where why Nepal in Nepal there are so many practitioners of Sowa Rigpa, and the relation between Ayurveda and TCM, we say Chinese medicine, is that there is a history in the Tibetan civilization and the history of Sowa Rigpa. We have this era of monarchy era where the king has done or contributed a lot for the development of Sowa Rigpa. And at that time, so many of the Ayurvedic doctors and Chinese doctors were invited by those king. And then,
Tibet.
Yeah, to Tibet, and they kind of exchange not only medical knowledges, they exchange have a great exchange between different cultures as well. So during that time, Sowa Rigpa has a great influences from those Ayurveda and the TCM. So you will see lots of similarity, especially the concept about the three Nepals, which is called in Ayurveda, I think it's three doshas. In TCM, it's about the chi excessive deficiency in something. I'm not sure, but they have this similar concept. So that's the similarity and the relation between Ayurveda and TCM and Sowa Rigpa.
Yeah, so maybe with TCM it's hot nature disease and cold
Yin
nature
and yang,
disease.
yes.
Yeah, I think it's similar, yes. So okay, so it's like geographically, it's Sowa Rigpa is in Tibet, Nepal, Mongolia, and this Himalaya region.
Yes, India.
Okay. Now we will talk about three Nepa, Lung, Tripa, and Beken. Could you explain us, Princess, what is Lung, Tripa, and Beken? Please.
So basically in Sowa Rigpa medicine, we see the patient's principal energy, which we call this Nyapasum. And this is the basic energy and the basis of what we diagnose the disease and healthy condition, unhealthy condition. And we have like three principal energy. They are Lung, Tripa, and Beken. And Lung is mostly connected with the wind element, and Tripa is connected with the fire element, and Beken is more connected with the water and earth element.
Okay, so we can say we have Lung, Tripa, Beken. You call it energy,
Yeah.
but it's like for Western people, like translated to energy. Maybe it could be make a little confusion. So we can how to explain it different way. Do you have some idea, like to say about the Nepa, or is it possible to translate?
Nepa, we translate it as a principal energy, but if we say energies and the energy, if we have to call it like our body formation, it is formed with the five element. And so in the connection with the five element, we connect the energy or the our principal energy inside, we connect with the five element. So yeah, we can even call it and relate with the energies if Western people or they want to think that energy, then that's okay. And yeah, that's
So we can translate it as a humor, energy, okay, or it's there is connection with we can say with our mind,
Yes,
or with
yes.
our thinking, our thoughts,
Yes.
with our body, so how it's built, yes, and with our function of our inner organs, yes.
Yes.
So could you explain more, please, this connection? So how about Lung?
Yeah, it's the more wind element. So the wind element helps in the movement, because you can say the wind is always flowing. So it helps in the movement, the psychological thoughts, and in the joints we have wind, because it is helping in the movement.
To move, joints.
Yeah.
Okay.
Joints. So yeah, that's the wind. Lung.
Also maybe blood.
Yeah.
It's flowing. Same.
In the flow of the blood, there is a wind, and in the way of thinking, what we think, and the psychological thing, our mental thing, mind, there is also wind.
I think nowadays people has problem with wind because think too much. Yeah. So
when the wind rises, it is like more stress and anxious.
Okay. So more wind, it's more stress
Yeah.
and more anxiety and all these things.
Yes, yes.
But okay, maybe come back to wind. So wind, like movement, and what about in body joints, fluids, and how people with wind looks like?
The people with the winds, they look more like, if you have to say the external features, the people with the wind energy, they have more thin nature because the wind is more light and yes, thin and lean. Because the wind energy it more like light and rough nature. So light and rough nature how to say absorbs the energy, so it makes them people more lean and thin. So people are more lean and thin. Those who are like wind, and they are like always talking.
Talking a lot.
Yes,
Okay.
yes. They are like not sitting in a one places. They are like not stable. They're going here and there.
So sometimes we drink a lot of coffee, so we have more wind.
Yes,
also.
yes. Because the coffee has more rough potency and light potency, so it increased the wind, and so people start to talk a lot, and they cannot sleep. Yeah, and
So we have body,
Yes.
we have mind. So, and what problem people can have if there is too much wind?
Yeah, if the people have more excessive lung, then they have like problem with the sleep, insomnia. They can face some insomnia. They can face some like stress, mentally stress. They like feel even the loneliness because of the when people they think a lot. Yeah, and the joints pain, sometimes joint pain, the crackling sound in the joints, and the skin roughness. Yeah,
Okay.
when we sit and when we cup, our bone make crackle. Yeah, this is also one of the wind problem, and skin roughness because of the less nutrition in the wind. People skin rough, the cracking skin, and sometimes numbness in the body. Yeah.
So if you have pain like back pain with referred pain, there could be connection with wind, with
could be
lung.
connection with the lung. Yeah.
In joints, there's a problem with stiffness. Yes, it's also.
yes.
Of course, it could be connection with other nipa, but
Yeah.
main it's because of
Yeah,
wind.
we can see like the person constitute and everything, and if they are connected with the other nipas and lung also, it cause a problem with the joints and some problem with the like numbness or stiffness. That
Okay, so we have lung like wind. Then second is
Tripa.
tripa. Tripa is, what is it, tripa?
So Tripa is more related with the fire, and the fire means you can see the fire is more hot energy.
Okay.
Yes, more hot energy. So people with the fire energy, they looks like the body. They are like more medium, not neither too fat, neither or not too thin. They are like medium texture, like they made a build up the body.
So with big muscles, yes. Okay.
Not too
No?
big, but
Okay.
medium one.
Medium.
Yeah, and they are more anger and their body, if you have to see from the externally their body is more reddish in color, and they are like active. They can go, if you ask them to work like this and this, they okay, I can do it, and they have more sharp mind as well as
So sorry, they have
Sharp
more
mind.
Sharp mind.
Yeah, if you say something, they will catch
so
it
they
up.
do it.
Yeah.
Okay, I will do it. They do it.
Yeah.
In body, okay. If I go to gym, I do it. Yes.
Yes.
Wind, maybe go to gym and maybe lost in the way. Yes.
Yeah.
But okay, man with strength. Okay. Okay. So the body. What else with the body? Hot nature. As
Yeah.
you said, fire. So everything with hot.
Hot, yes.
So there is connection with some disease, like with inflammation, isn't it?
Yes. So if you have to connect with the disease and the organs in our body, the Tripa is more connected with the liver and gallbladder, because the liver and gallbladder, they are more blood, and there is more fire to do the circulation and everything. So whenever we have like Tripa problem, we are mostly we are supposed to have like problem with the liver, or blood circulation, or gallbladder, and more anger.
Okay.
Yeah.
So if you are more angry, with stuck with somebody, and very
Yes,
shouty and
yes.
so on, this is a symptoms.
Yeah.
So maybe if we eat too much spicy food,
Yes.
we are more red on face.
Yeah.
Some of us, yes.
Yes,
Our liver have work harder.
Yes.
And then later, if you drink a little alcohol, so it's worse. Yes.
Yes.
And there is more inflammation in your body, so we can have some symptoms in inner organs. Yes?
Yes.
Connect with inflammation.
Yes.
So it's
Yes.
more like this.
Yeah.
Yes?
If we have like more spicy, more oily, and more, as you said, alcohol, and these things increase the Tripa energy, and it causes the imbalances in our body, and we start to have slowly like problem with the liver, gallbladder, blood circulation, and inflammation, and some infectious disease also. Yeah.
Infectious disease.
Yeah.
Like what? Infectious like...
Like even if we have to say the skin, the wound is like in the skin. If you have some wound or anything, that it can easily get infected.
Oh, okay.
Yeah. So
Also like nose infection is
yeah,
connect?
yeah. Sinusitis is
Sinus-
also
okay.
connected with. If you have to connect with lung and Tripa, there is also like sinusitis.
Okay.
Yeah.
And then headache maybe?
Yeah, sometimes there is also different type of headache.
Of course.
And if we connect with the Tripa, there is one Tripa headache, which is more sharp pain, and it causes more irritation also. And this is more Tripa headache.
Yes, and you can see a vein of his,
Yeah.
somebody head and red eyes.
Red
and,
eyes, yes.
Okay,
Yeah.
so more blood in head, yes. Okay, so Tripa, strength, yes, this, inflammation.
Yeah.
Okay. Third one is Beken. How looks people with Beken energy?
Yeah, okay. So Beken is more earth and water energy. So this is more cold. And that means cold means there is not much movement. So there is not much movement. That makes like freezing. So it is like more people with more big or fat or pig complex. They are not like doing that. They don't like to walk a lot. They don't like to engage in work a lot. They just like sit and think inside. Yeah, and they are just like they tends to think a lot inside, but they don't express a lot in outside. Yeah, these are more Beken people, and sometimes if we see they are more whitish and complex.
Sorry?
White color.
White color,
Yeah,
okay.
much more white color. If you see Western people, they are also white in color.
So you think Western people from Europe are more Beken?
It depends. It differs as per the like our extra environment as well as. But
Because in Europe it's more cold.
Yes,
maybe,
yes,
And
yes.
especially in
yeah,
north,
yeah.
yes.
So yeah, and the Beken people, they have more cold palm and cold legs and cold body. They don't work a lot. If you say they are like more lazy.
More lazy,
Yes.
don't move, okay, and the body is more fat.
Yeah.
Okay, so this is Beken, it's connect with earth
And what?
and water. It's more cold.
Yes.
So probably we have to warm up them.
Yeah.
Okay. So what disease they have? Like in joints, it's more what swollen, I think.
Yeah.
More water.
Yes. Because of more water and earth energy, they are more like the collection of the fluid in the joints, are the collection of the fluids in our body, and kidney is also more cold. And if we have more cold, then we tend to have more kidney also, like frequent urinations are like cold in back because lower body is more cold.
Okay.
So
usually people with back pain, lower back pain, there is connection with kidney, isn't it?
Yes. Usually because of the cold energy. Kidney is already cold energy, and because of more cold energy, they have more back pain.
So this way we have to make a little fire in this area. So warm up through the massage or using moksa.
Yes,
or...
moksa is better, and even the some oil application, hot oil application, and we can do some mobilization, so it can enhance the Beken, because Beken is in the joints. Because of the connective Beken, the joints are joined.
Okay, so we have to do a movement in the
Yes,
joint, then the Beken go spread around and go out.
And
As then
increase the
warm
movement.
up, yes. Okay. So movement is the best for Beken people.
yes.
So for fat people, they have to move.
Do
so
exercise.
It's so easy, isn't it?
Do exercise, keep warm, and do movements. That's the best thing.
Okay. So we have Lung, Tripa, and Beken. And the other hand, we have also combinations.
Yes. We have combination, like there's two combination. One is like Lung and Tripa combination, Tripa and Beken combination, Beken and Lung combination. Like this, we have a combination of the Nepal as well as per the combination of the two humors, the person has like different signs and symptoms.
Okay. So maybe we can think about me, okay? So what is about me? I'm like look like Beken, and but work and do everything like Tripa.
Tripa, yes.
Okay.
Even if I have to say, your external appearance, you easily get like reddish in color, and that's why I can say
It's because of spicy food in Nepal. You know.
So yeah,
So
it's spicy food that hits you really quick. That means it's fire.
Yes.
Yeah, and your complexion is a little bit big, so it is Beken. So we can say you are a combination of Beken and fire, Tripa.
In my body.
Yes.
So I can be easy to swollen my joints
Yeah.
if I don't move.
Yeah, if you don't move, it is easy to like you to get like swollen in joints, and maybe in moments you may can feel difficulty in joint movements or walking because of if you don't work a lot because of Beken. But at the same time, you have a Tripa. So sometimes if you take like Tripa food or increase Tripa, it may can increase the movement as well.
Okay.
Yeah.
So can make some inflammation if I let my body.
Yes, yeah.
Okay. So, but on the other hand, I think if it's Beken, it's cold, Tripa is hot, so it's a good combination, isn't it? Or
yeah, if they are in balance, it's a good combination. But if we say they are more excessive or less deficient, then this is not a good condition.
So always there is thing in balance.
Yes,
In
everything
Lung,
in balance.
Tripa, Beken.
Beken.
Okay. So just explain me one thing. So everybody has Lung, Tripa, Beken in their body?
Yes. Everyone, because I already told you that our combination, our formation of our body is from the 5 elements. And the 5 elements makes the 3 humors. And all of us have 3 humors, which is Lung, Tripa, and Beken. So our body is made with the 3 humors. And if this is in balance, this is the healthy condition. If this is imbalance, this is unhealthy condition. This is condition.
And we can think about it at the body level and also in our mind level. It's different.
Body level and mind level. Yeah, this body level and mind level, it is different. But sometimes body and mind, they combine and function it in a function it like together and makes us like body as a whole.
Oh, okay. Yeah. So we can have like body more fire, yes, more tripa and more inflammation, and in mind more wind.
Wind,
It
yeah.
could be, yeah.
Yes.
So there is somebody who can have some worry about everything in the mind, and in body have inflammation.
Yeah, if like people have more thinking or the stress going on the mind, it affects our body as well as. It depends on people constitution as well as. Some people are dominant with the Tripa, some people are dominant with the Beken, some people are dominant with the Lung, and the people with the psychological more imbalances, more Lung, it can increase the as per their constitution, it can increase the Beken.
So Lung in our mind, so our depression of our worries, thoughts, they're increasing our Tripa, can increase, so will be like fire, like wind coming to fire, so will be more fire. Yes, so it's more inflammation, can say.
More anger.
More anger, okay. And if this lung, this wind come to our body and we are cold, so we'll be more cold.
Yeah, more
so we'll be more frozen.
More frozen, more lazy. You don't want to work anything and you don't want to share what is going on inside you.
Okay, so more depression, more close, more frozen. Yes. Or more anger, more fight.
Yeah, when you are more Tripa dominant and the stress going on, then the more anger and more pride and more you say you don't keep things to yourself and you say and you start fighting.
So so Lung, Tripa, Beken, there's connection with body. We can say with mind, so thoughts, or main thoughts. It's just to summarize. Lung, it's more like cannot think. Yes, it's running in your head. Lung. So very often nowadays, and people.
Mostly.
Tripa, it's more anger, when we are easy to be angry and fight with somebody. Yes. And Beken, so we are lazy, we don't think too much. Yes. And it's more connected with ignorance, as I heard. Yes. So we are just stupid. Okay.
Because ignore the
so
things.
more wind and more stupidity.
Yeah.
Okay, we can say.
Yes.
Tell us something about diagnosis in Sowa Rigpa.
Okay. So the diagnosis in Sowa Rigpa is very similar with the different traditional medicines, but if we want to speak with like the diagnosis first, it's a very vast subject. So there are different innumerable types of disorders. So as per that, there are specific principles, like I would say formula, to diagnose certain disorder. But so if we kind of summarize all the disorder, we either say it's a hot disorder, hot nature disorder, or cold nature disorder, or even a little bit more simpler, we talk about the three basic energies, three humas. So we can diagnose all the disorder, no matter whether it's hot or cold, into Lung, Tripa, and Beken. That's the diagnosis that we do, even though there are numerous different type of disorders.
Okay, so simply way we have hot nature disease and cold nature
yes.
disease. So what is hot nature disease? What is it?
Yeah, so if you have a little bit idea about the three humas, so we call the Tripa, which is the middle huma. So I think in Ayurveda you say water pitta, which is the Tripa, hot nature, fire element dominant is Tripa, is considered the main cause of almost all types of hot disorder. So it has to do with different kinds of infectious disorder, contagious disorder like COVID and all these things, and inflammations, and there are
Like
different
joint inflammations?
yes,
Same,
yes.
same.
But then that also has like far more
Of course,
different types, yeah.
But simply way, yeah?
Yeah, even headache.
Headache could
Yeah,
be, okay?
yeah.
What else? Any pain with redness, yes?
Yeah, that's a more like simple way to say it, yes, but like the redness, inflammation, which is like we say the immune response about the redness, swelling, yeah, itchiness. all
Yes,
these
so
things,
okay,
yeah.
just simply, just want to explain our people, Western people, simply way, yes? We don't
Okay.
teach them. Okay, so hot nature, with all inflammations, redness, you can have like pain, sharp pain.
Yeah,
yes?
sharp pain. We also call it like localized pain, where you can feel exactly at the same time, maybe today, tomorrow, and day after tomorrow.
Okay, so
That's
this
the
is Tripa,
localized
this
sharp
is
pain.
hot.
Yes.
So on the other hand, we have this cold nature. So could you explain more, please?
So from the three principles, we call the Lung, which is the wind energy, water, and the Beken energy, which is the earth and water. We Kapha, I think, in Ayurveda, is considered as the cold nature disorder. So again, we call it because among these two principal energy, normally if you are a learned like Sowa Rigpa doctor, we always refer Beken as cold nature disorder most of the time, because we try to differentiate the two principal energies a little bit different, because we say Lung is more of a, rather than the, because Tripa has to do with fire, Lung is like, we call it dual nature. It helps with Tripa to blow up, like we use we need this oxygen to
make a fire.
yeah, we
yes.
call it combustion of something.
Yeah,
here.
okay.
Yeah, and then we call it Beken as more cold nature, because in compared to Lung, so Lungs also help with Beken. It's like
yes. If we are
friendship.
outside and there's snow and cold, so
Yeah.
if there's a wind, so we
Yeah,
feel
it
more
makes you-
cold.
yeah,
Of
more
course,
cold,
maybe,
yeah.
and we can be frozen.
Yeah,
So
so Lung
this
and both
Lung,
Beken.
wind can come to fire and make it more.
Yes.
And the other hand, come to this cold nature, Beken, and make it more cold.
Yes.
Okay.
So, and basically in Lung and both Beken are referred as the cause of all cold nature disorders.
Okay. So what kind of, give me please some examples of this cold nature disorders. Yes.
So if we say about the Lung, in the sense of cold nature disorder, it can talk about stiffness, waist pain, joint pain. Yeah. And then from the Beken point of view, it's about indigestion. So you get
So the
Yes,
indigestion, and it's giving you pain, like in back pain, yeah?
yeah,
and
back pain,
area
dullness,
of,
these
okay,
things.
there could be a back pain in area of kidney.
Yeah.
It could be back pain area with stomach,
Yes,
higher,
yes.
of course, and then could be back pain area connect with
The joints.
the joints,
As
okay,
well,
and
yeah.
joints, okay, okay, and then and the all joints like elbow, like knee, it could be connection with this Beken when you cannot move.
So,
yes, we
yeah.
can feel swollen or not.
The thing is about the joint pain, it's both the Lung and Beken can have a great influences, because we say like your bone is the location of Lung. So the wind energy. But then
So in bone there is a
Yeah.
wind energy.
yes,
Okay.
it's a location of wind. But then if you talk about the joints,
Okay.
because there is like a lubricating, we call it spinal fluid or something
Yes,
like
yes.
in between like vertebra. So if we talk about this, that kind of lubrication has to do with Beken energy. So that you when you get older, you have this cracking sound. It's because when you get older, your we say wind energy excess
Yes, more wind.
goes up.
Yeah.
In complete to Beken, so you have this cracking sound because the lubrication in between that kind of get lost, right? So that's why joint pain and all this thing has to do both with Beken and
If it's around. But if somebody say, oh, it's here, so you think more tripa, hot nature. Okay. So swollen, Beken,
yeah.
like stiffness, cracking, lung, wind, and this place it's more, we can say fire or
Yeah, and then also like if you compare it with the Tripa pain, so it's, I said, it's more localized and more sharp pain. So the Beken pain can be more dull. You will feel like it's pain, but you don't really feel it like that kind of intensity. But in Lung, you will feel like, oh, today it's here, tomorrow it's in
it's
another
moving.
part.
In lung,
Yeah,
it's
called
moving. So
shifting pain.
patients coming to office and say, oh, I have shoulder pain, but yesterday I had more elbow pain.
Yes.
Or maybe neck. So
Yeah.
this is more lung, wind. Okay, Beken,
It's like more dull.
more dull. And
Yeah, you don't really know it's a pain or just discomfort. They always
Discomfort, okay.
explain it as
Yes,
discomfort.
and people want to move, and then it's better if they move. Okay.
Yes.
If there is a tripa, so it's a sharp
Sharp
pain, coming with big pain. Yes,
Yeah.
I cannot move at all.
Yeah.
Okay. So how you do Moore's diagnosis?
So the diagnosis thing is we have three main diagnostic criteria or the method. So the first one is like we call it Longwa Yugin Takwa, is like you can diagnose some disorders based on what is the cause and what are the conditions that manifest this lung tipa and Beken. And another one is you can diagnose through the sign and symptom. We say Takwa is like this just based on sign and
Please
symptom.
don't say so fast in Tibetan. So first one, could you repeat, please? First one was
it's based on cause and conditions.
a big base of cause and conditions. Yes.
And the second one is based on the signs and symptoms of the disorders.
Okay.
Yeah, and the last one is it's based on what is beneficial and what is how does your body restrict to certain diets and lifestyles.
Okay, so what the patient is moving and say to you,
good?
I feel better if I move.
Yeah.
Or I feel better if I lie down. So you know what
That's
nature.
also a way of diagnosing as well.
Okay, so the first, how can you do diagnosis?
So based on cause and conditions, so we say if you have too much attachment, we talk about the mental poison, all this thing. If you have too much attachment and if you kind of are obsessed about something, you are like kind of mentally into too much, like obsessed about something, there's a chances that you get lung disorders.
Okay.
And if you're very furious, anger, always aggressive, then you have more chances of getting Tibet disorders. And then you're more of a lazy, you always escaping, procrastinating.
Yeah, you don't know where to go, left or right. Okay.
Always maybe stupid.
Yes.
Yeah, minds are more cloudy, then you have more chances to get Beken disorders.
So it's more on the mind level.
Yeah,
cause.
yeah.
And body level? It's
yeah, body level, so lung is like more hyperactive. So we in this era, many of the children are diagnosed as ADHD. So it's like they are more
also in the US, ADD,
yeah. So hyperactive is more of both physically and mentally. It's more of a lung disorders. So and then Tiba both mentally is more aggressive. So physically they crave or either are indulged in strenuous activities. Maybe athletics, like they are running all the time here and there. Maybe gym workouts, and we normally have this example where horse riding. Like traditional examples of horse riding, these are physical probability of getting Tibet disorders. Okay. And for the Beken, it's lazy. You don't want to do anything. Mentally, you procrastinate. You might say, I want to do it maybe tomorrow. Physically, you don't do it. You just maybe lay around.
Okay, so I go to gym, but tomorrow...
Yeah. Yeah, maybe just
Okay.
get the
I will
maybe
do my work, but tomorrow.
yeah. So the procrastination
Procrastination.
and the dullness, sedentary lifestyle, we say, like a luxurious lifestyle, has more chances of getting pagan
Like in
disorder.
Western people.
Ah,
Lazy,
maybe
lazy.
some
Maybe,
Nepalese as well.
But I'm not sure. It's usually like on one side it's lazy, on one side have depression, and
Yes.
sometimes they're HJD. So it
Yeah,
could
all
be
things.
Lung, Tripa, and Beken.
Yeah, there's like if you talk about the constitutions, we talk about 7 constitutions. So one is Lung, Tipa, and Pagan. So another one is Lung, Ti, and Pelung, and then there is called Dupa, which is a combination of all 3.
Yeah.
So if in balance, the best is Dupa, but if it is in balance, Dupa is the worst.
Oh, okay. So
Yeah.
again, balance is the most important. Our mind
Yes,
and
yeah.
our body.
Yes. Yeah.
Okay. So more about diagnosis, please.
Yeah.
So because we can read from the body, isn't it?
Yes.
How to do it?
So, if you want to just look at someone and then want to know what kind of, like, especially if we say disorder like Nepa is his, you can just read the body stages, like your body physic. So if someone is very skinny, maybe complexion is kind of pale but bluish color, like complexion. It's more of like we say lung, and maybe you can also read the gait, like the way he walk, like maybe he walks with like with foot sliding around like like walking as if he doesn't have any energy, she is weak kind of thing. And you will also see like a little bit of dullness. Let's say you will see like someone, if you didn't get enough sleep, like insomnia, and then they have this kind of as if they are intoxicated. That kind of is the physics that you can see. And that's the normally the
Like
physical,
general physical,
yes,
yeah.
that
So it's
you can
lung.
see. Yeah.
The Tripa,
The Tiba will be like physically they are more muscular, and we have the
Coming.
saying,
coming to your clinic fast,
yeah,
yes?
yeah. I forgot to tell about Lung. Like we on the base of ages, we say all age are more Lung people. So you'll see they are very weak, they are very stiff, and then they overthink. They want to do something, but they can't do, so they overthink a lot. So and then the Tipa, they are more muscular. So as per age, the young adults, like we say 16 plus, 60 minus, but generally, practically, I would say 50 minus, with more Tipa. So they are muscular. They sweat a lot. The complexion,
Smell.
yeah, that's why. And then the complexion is more oily,
Yes,
reddish
like-
color. Yeah, and then they can have a lot of pimples around because they are oily. The body pores get blocked by this oiliness, and they can have this kind. And then they love to do different things, and they are quite competitive in nature. Like
Yes,
maybe
boys
I
are-
want to achieve this.
I will be better,
Yeah,
yes.
yeah. Maybe they want like make to-do lists, and they want to do it
Okay.
right away. And mentally, they're quite sharp as well, very intelligent. Yeah.
Okay.
So that's the Tipa.
Tripa. And
Yeah,
the
and
Beken?
for Pekin, I would say more obese. They're very fat, and you can't see really. If you want to check, let's say, where do you have pain? You can't feel their joints as well. because
okay, looking
they're
for a joint.
Yeah, fatty, and so we say like in Sowa Rigpa, Pekin persons are very patient and tolerant, and they have this white complexion. So you because the blood vessels, both the joints and blood vessel won't be as visible as in Tiba and Lung. So they have white complexions, and the procrastination is always there. They just lay off everything.
What about diagnosis and eyes?
So for the eyes, we say for a Lung person, you might see like their eyes have like gazing, like gaze. We say a big eye looking at you kind of thing. And then for Tiba, it's like a gaze, but as if like they want to kill you. This penetrating eye,
Okay.
yeah. And then pagan eyes is just dull. They don't have interest in anything. Yeah. Just ignore.
Okay.
Yeah. And then also we say like the pagan eye, the sclera, we always have this when we do diagnosis about your eye, we always look at your sclera. So in sclera, in pagan person, they have this grayish pale color. And in Tipa, you will see the bloodshot eye, where it's not the sclera, it's the blood vessel which is quite protruded. It's prominent. You can see the blood vessels, and that's why the eyes look red. And in pagan, you because of the veins, so the eyes can be a little bit reddish color. It's almost like conjunctivitis.
In Beken, no.
In Lung.
In
Sorry,
Lung. In Lung.
yeah.
Lung. Okay. So in eyes,
Mm-hmm.
just to summarize. So Tripa, it's more red,
Red, yeah.
reddish.
Yeah.
Yeah. Lung, it's more.
Reddish, but the veins, because of just the vein, like you will see the sclera.
Oh,
In
okay.
Tiba, it's the blood vessel which is quite prominent. That's why it's reddish.
Oh, okay.
Yeah.
And
And
Beken,
pagan is
nothing.
dark. Yeah. It's grayish.
And also some parts of the eye, it's like connect with inner organs.
Yeah, this is more of a deeper level. So
Tripa.
yeah, we say
Oh,
deeper
ah,
level.
deeper
Yeah,
level,
if you
okay.
wanna like, there are certain positions like small intestine, stomachs, and all this thing. I'm not sure about it.
You want to say it or
No.
no? Okay. So what about nose?
The nose, there isn't specific about it, but there is like, let's say in case of cold nature, let's say most of the sinusitis, it has to do with the blockage. So we call it like yamakarbo and yamanakbo actually. There's two types of sinusitis, which is like cold nature and warm nature. And basically sinusitis is more to do with this microorganism like infection, virus and all this thing. But pagan is like more blockage, stuffiness, and many, what do we say, nose drooping.
Okay,
It's
running
like,
nose,
yeah,
and
running nose,
water
and
coming
that's
out.
quite
Okay,
yellowish color.
Yellowish.
Yeah.
It's more Beken, cold nature. Okay.
And then in Tipa, we say like the nostrils are quite open. We say Napu Harwa is like the nostrils will be called big.
Okay.
It's normally it's okay, but suddenly it becomes like more open.
Okay.
This kind of thing, and you might get this pus separation around your nose a lot, like red pimples and always getting infection around the nose. That's more of a Tipa.
More Tripa.
And for lung, it will be it has to do with the runny nose, like water droppings coming out of
Lung.
you. Yeah.
Lung, like more water, no yellow.
Yeah.
Yellow, it's coming from Beken.
Yeah.
But Tripa.
Like Tipa is like more pus formations, and there is always also a thing where
skin
you
problem.
get nose blockage because your muscles inside it get inflamed. That's more of a Tipa.
Ah, okay.
Yeah.
And Lung, it's just water.
Watery,
coming.
runny nose,
Okay.
like we literally said. And also you can feel like in Tipa and in Lung, you also feel like this nose droppings are dry.
Okay.
So it's kind of
And what about mouth?
about the
lips?
mouth. About the mouth, so for Lung, your lips will be more pale and very even the eyes and your mouth, it's in Lung, it's like very small size. You will see as if it has squeeze, and it's also you might feel very dry. And rather than in Sariba, rather than the mouth, we talk about the tongue.
Ah, okay.
Yeah. So in tongue, you'll see like cracks, especially in the center. Then it has
Do I
to do
have?
with your heart. You do.
Uh-huh.
Yes,
What
you
is
do.
it?
Yeah. So it's like it's a sign of lung. So many of the crackings has to do with the lung. But if it's at the center, it has to do with your heart. So we say maybe something's wrong with your
So
heart.
like we can say like here, it's also
Yeah.
with heart.
Yes.
So it means broken heart or love or what?
No, some issues with your heart.
Okay.
So maybe your heart will.
So maybe work too much and
Yeah, you
and,
can get
take-
this. Either you are overwork or burnout, but also maybe you have some heart issues like palpitations, and insomnia can cause a palpitation, anxiety, all this thing.
Okay.
So this lung has this crack.
Lung is okay.
Crack.
Crack. Yes.
Yeah, and
lung.
it's also dry and rough.
Okay. No, it's
As
not,
if like
it's
as
not
if
dry.
yeah, it's not dry.
Okay.
So as if there is no mucus inside your
Okay.
mouth. So lung person tend to have this dry and rough and crack tongue.
Okay.
And for Tipa, it will be really reddish. Not too much.
Not too much. Okay.
Yeah. And then you will see a yellow coating. That's
Yellow.
the white coating. It's more of a yellow coating in Tipa. And in pagan, you will see it's very wet and
Wet?
smooth.
Okay.
Yeah. No.
No.
Still
Oh,
no.
so good. I am balanced.
we can't just say it from just
Yes, of course.
tongue. Yeah.
It's
So-
part of our diagnosis.
Yes. So also you will see it's very smooth and wet, but at the same time, what do we say? It's very flexible at the same time. Like you see, yeah.
For Beken.
Yeah, for Beken.
Okay. You can move. Okay.
Yeah, and then even though it's wet and smooth, you won't see it as lustrous as it is. Like, it's not pinkish, it's not reddish, it's more of a pale and many white coating.
Okay.
Yeah.
So what else we can see?
On
the face, we can see more?
The complexion we talk about, bluish
Complexion,
is more,
yes. Then you can see, like, look deeper in eyes. There is some different organs in eyes.
Yeah,
Okay,
even
but we'll
in-
not go to this,
yeah,
just
even
to
in your
explain.
nose and mouth and
Also
ears,
nose,
yeah,
parts of the
everything.
nose, there's connection with your liver, with your stomach, yes, and
Yeah.
different parts. The same lips around, there's connection with your
Yes.
inner organs.
Yes.
Then you see, like, general, we're talking about tongue, but then we can also check
Yeah, the
veins,
veins as well.
veins
Yeah.
here, yes. Okay, then we see body, and also we can check the spine,
The
isn't it?
spine, yeah.
Could you please show us, like, back diagnosis on
Okay.
spine?
Yeah. So normally in diagnosis, we always talk about 3 ways. We call it interrogation, where you ask the patient. Another thing is you touch and feel if there's something wrong. Another is the visual. You see if there's anything wrong without touching or without asking. So you can see, like, the first is visual diagnosis. So you can see if the spine maybe up and low, if there's like curve with this, there's what do ACAS and all this
Yes, yes.
ankylosing and this all this thing. So you can also diagnose by seeing if there's something wrong with like abnormality.
Okay, with spine and with muscles around.
Yes. And then you can ask the patients where there's pain. That's also a way to diagnose. So maybe he's a back pain, and then you can just press whether it's quite severe or not. And then on the base of that,
I have a question. If the patient say that I have back pain, so also we can think like Lung, Tripa, and Beken.
Yes.
If he say here, so it's more Tripa.
oh yeah,
If he say
Yes.
somewhere here, and so it's more Beken, yes?
Yes.
If it's here or here, it could be Lung. Yes?
yeah,
Yes?
yeah. About the pain, shifting pain is more of a lung diagnosis, and if it's quite localized and very sharp, it's Tripa. And if it's dull, just he might say I have lower back pain, but it's discomfort. But is there? I don't know exact location. That is more of a pagan diagnosis. So normally, in the spine diagnosis, we have certain points where we will designate it to certain disorders and organs. So we always go like the first. Normally in modern medicine, we have the 7 cervical bone, right? So the the C7 is considered as the first thoracic of Tibetan medicine.
Okay.
So you go, it's a bulging bone. So it's called lung point. So it's like if you press it down and if there is pain, so you can confirm, okay, lung.
Okay.
Yeah. And
So
then
C7, so it's
Is the first vertebra.
Tibetan vertebra.
Yeah, we call it T1.
T1,
Yes.
yes. And there is a connection with Lung, with
Yes,
wound.
yes. And then also you can go like 2 fingers of the patients on side as well. Just on the spine, you go 2 finger. So there are 3 points of lung. Okay, and then 2 finger down. If you're not able to find the vertebra properly, then you can use the fingers of the patient's 2 finger and down. Exactly, you will go like 1, 2, 3, 4, 5, 6. That's and the second vertebra is lung tiba. So you can again go 3. There are 3 points, and then if you press it, if there is pain, discomfort, then you can confirm it has to do with any of the issue has to do with the tiba. And then the third one is Beken. And then 4th and 5th is lungs. Yeah, 4th and 5th. 6 is your life channel. It has to do with actually with your heart. So we normally say 6 and 7 is heart and life channel. So it is also very much connected with the lung. So if you want to do some therapy, so if there's mentioning of you do therapy on certain lung points, we consider the first vertebra that we talk about, and also the 6 and 7 as well.
Because the lung and its connection with your
With the heart,
and
yes,
everything,
yes. And then the one of the most common is the 15 vertebra. So we call it the most common point for all 5 vertebra and 6 vessel organs. So the 5 vertebra has to do with your upper like heart, lungs, livers, and all these things. And the 6 vessel are your stomach, metabolic, like intestine, colon, and everything. So 15 is also very important. If you press it there, and then if there's pain, you can say something's wrong with your whole like organs, maybe too much fire, too low fire kind of thing.
15 is what? L3?
I don't know.
This is
We
it.
need to count.
12,
Yes.
12, 11,
Mm-hmm.
yes. 13 is L1,
Mm-hmm.
14 is L2,
So,
L3.
L3.
Just
L3.
according to what I think.
according to
L3,
what-
yes,
oh, yeah.
L3.
L3.
It's
And-
very important because
Yeah.
there is connection with, could you repeat?
With the whole organs,
Okay.
the 5 vital organs, and we say 6 vessel organs. So that includes your reproductive organs as well. So, and then normally the back pain mostly has to do with, we say the nerves. So we have a certain 6 main nerves. We say Ratna, Saradna, Jache, and Bugujin. So we had, and then most of the time, what you will find is if there is pain around here, we press, and you will see some like what we say, the nerves, or we call it channel. So there is some stagnation over there, and if it goes down, you can also say it's sciatica. So if it's like going down and then coming up through here, so you can call it sciatica as well. So you can press and you will feel like how to say this stagnation.
Stagnation
like-
in channel, or
yeah.
we can say there is a problem with nerves.
Yes. And then the just above, like on the 20th, the T20, which would be the
It's like
tailbone.
sacral bone, yes.
Yeah, the sacral bone. So we call it the point of descending lung, which has to do with your
Descending to womb,
excretory
so
system.
It's your wind in your lower part.
Yes.
There is connection with your inner organs.
Yeah, we call it it has to do with the excretory system.
Okay.
So the bowel movements are not good. You have urine obstruction, constipation, or maybe too much diarrhea, that kind of
And
thing.
it's like also this woman problems, yes? Like
Yes,
woman
yes,
problems,
yes. The white discharge and all these things.
Yes.
Maybe severe menstrual pain as well. So we do like some moxibutions and hormone on that T20.
So we have to check which one point, the first.
Yeah, yes.
There is connection like points here we have, yes?
Yes.
We have this chart here with
Yeah.
points. Okay, then we have to also find some nature of points. It's more Lung, Tripa, or Beken.
Yes. The
Okay.
points, we call it sangmik, the points. Yeah.
Okay, because so we are looking, so we have some pain here. Then we looking for, is it more cold or hot?
Yes.
Connection or Lung, Tripa, Beken, and
Yes,
then we do treatment according to
Thank you.
Lung, Tripa, or Beken.
Pain, yes.
So we can
Or hot and cold.
or hot and cold.
Yeah,
Okay,
that's
so we
all.
can, if it's cold nature, so we can warm up,
Yes.
like use moksa,
Yes.
moxibustion,
Yes.
yes, or we can warm up
by horme,
by
compression.
horme,
Yeah.
yes, or using warm oil
Yeah, and cupping.
and
as well.
also cupping.
Yeah.
Cupping is good for what?
It's for both so hot nature and cold nature. And the thing is, if there is cold exposure and if we want to retain the heat inside, we can do cupping because we heat the cup and then the heat stays inside it. And if it's like warm nature disorder, so you can do the cupping more to take out those heat as well.
Okay.
So that's the two way you can.
So cupping makes balance.
Yes.
Okay.
Yes.
So we had cold nature, but if there is a hot nature disaster, if there is a hot nature disease at this point, so what we can do?
We can also do compression because we have like compression, warm compression and cold compression. So maybe cold stones and this kind of thing
we
as
put
well.
compression like
Yes.
stone or
Yeah.
okay,
Yeah, you can do like
or
that as well.
some material with something inside.
No.
Salt?
Cold stone? No, salt is too warm.
Yes, to warm.
Yeah.
Yeah, we use salt
Yeah.
or compression. Just
Yeah, even you can use like the most easy one is we call bricks. You can just heat the bricks and that's also very
to
good.
warm up. Okay. To cool down, we can put a stone.
Cold stone, yeah, cold stone, especially collected from like river areas, from water sources. They have this by nature coldness, and also we have this thing. We have this the stone, which is collected around water sources, and you can see like many of the bugs have eaten those, like these rocks or the small pebbles. We call it carbon. So that is also very good cold compression.
So, but what do you think? It's more people have cold nature disease, and we can warm up, or more cold, or more.
Most of it's cold.
It's cold.
yeah,
So
cold.
usually we
It's
have to
always
use
the warm up.
Yeah,
warming
always kidney
therapies.
to warm
Yes,
up.
yes.
Yes, mostly you
Yeah,
see, yeah,
yeah.
like back pain coming
Yes.
on some, yes, and
Yeah,
on
even the
colds.
stiffness,
Yeah.
even though it might seem like it's maybe has to do with inflammation, but most of the time it's like a freezing energy. So we use warm compression,
Warm
even
compression
in
or
the
moksa?
stiffness. Yeah, both.
Both.
Mm-hmm.
Okay. So we have patient with back pain here.
Mm-hmm.
We can feel it. It's warm, but stagnation.
Yes.
So you can say that first we pacify lung,
Yes.
that we warm up,
Yes.
and then later we can put cold something to cooling down
No,
hot or not.
No, normally we don't, because by nature the disorder is diagnosed as cold, so we don't want to like conclude it with cold. We just do warm compression and advise him to do something like the diet and lifestyle all warm.
Okay.
Yeah.
So warming up patients is the most
Yes.
important
Yes.
nowadays. Okay. To pacify the pain and also bind.
Yes. Yes. And then normally, if you don't want to do therapy, like we always do some massage. It's like more of an activation. So you want to activate those muscles, like get it ready to get therapies. So
Okay.
that's also a good way
So
to
first
start.
you do massage, like relax muscles, warm up body, and then you can do points with
Yeah.
moksa
Yeah,
or
any therapy that you want to do.
cupping. Yeah?
Yes.
Cupping are the best, isn't it?
It depends on patients. Some prefer
It depends
some
of
don't.
therapists, I think. Yes, I know here in Sowa Rigpa Wellness Center, some Amchi doctors like him, they love to do cupping.
Yeah. So that's how we do the spinal diagnosis. And so in conclusion, I would say in the diagnosis, history taking is very important. So which we call it interrogation in Sowa Rigpa. So you ask questions to the patients because he will tell you about past medications, past history, all this thing, because you don't have any idea about the patients. And also it's very important that when the patients come inside, you have to go through this visual diagnosis. Just try to notice everything about the patients without asking, and and also try to know about the lifestyles and all this. This will give you a very big breakthrough, we say, to the treatment and even the diagnosis. So in conclusion, I would say the simplest way to diagnose a patient is whether that disorder is hot nature or cold nature, or is it lung, tiba, or Beken, and based on that you can prescribe some, maybe recommend some diet and lifestyles, which is we call it the best medicine, and then some therapies and maybe some literal medications. And so in conclusion, I would say if you want to do diagnosis, lung disorder has to do more with your mental thing. So insanity, psychosis, anxiety, depression as well, and this with the many of the behavioral disorders, like this like obsessive compulsive disorders, ADHD, and all this thing. And TIPA has mainly to do with your like the inflamed things. Most of the inflammation and infectious is related with TIPA. And the last Beken disorder has to do with your metabolism. So most of the time we have this in the root tantra, which is like the summary of all four tantra, has a saying that when you have excess Beken, your digestive fire, which is like the metabolism, dies. So that's the conclusion about the diagnosis.
Okay,
Thank you.
you. Okay, could you show us some therapy for cold nature disease and for maybe for kidney? Because I think people with low back pain, they have very often problem with kidney. Yes?
Yes. The people mostly with the lower back pain, it is more related with the kidney, or I can say the cold nature, which is Beken. And for the cold kidney and the cold lower region, we do mostly moksabation.
Oh,
Yeah, which is like heating therapy with the moksa cigar like this. It is made of a tawa, and we burn it and put it in some kidney points and the lower back pains whenever they have like more cold pain or anything more related with the cold or Beken.
cold, so Beken.
Yes.
Okay, could you tell me what is inside?
There it is like a tawa, or some they use like a mogwat, which is like moksa, and they dry it and roll it and put it and make a cigar like this.
So it's like special herbs.
Yeah, hearts.
Herbs, it's dried and rolled and then smoked.
Yeah.
Okay, could you show us how to do it?
Yeah,
How
of
to use
course.
it?
So first we will apply the warm oil. Ceramic the oil. So, and mostly in the lower back, in the kidney area, and the lower back, we apply some oil, just like to do the little massage, and we apply the oil.
So it's just general warming up oil and put warm oil on
the
back
lower
area.
back, yeah,
Yes.
on the back area.
Of course, we can do some special techniques, but we will not follow this. Just go to
Just
moksa.
like thoroughly and
Yes.
generally, if we go. And this is the like in if we talk about like vertebral point of the from the Tibetan medicine, and from the T14 we have a kidney point. So like from the T14 like here, and then like she said before, like 2 finger on the side and side here, and the 2 finger side here of the patient, and 2 finger side on the patient. So these are the more kidney points here. And furthermore, if we want to go, then 2 finger on the side as well as we can go here. And these points, we will do some observation.
Okay. So we can say it's which one vertebra you said?
T14, like Tibetan vertebra 14.
T14.
Yes.
So T14, it's
15.
L2.
Okay, yeah.
Yes?
Yes.
Okay. So we can looking for like 12 rib. Yes, it's like here. This one, it's like something like here. Okay.
Yeah.
So we're going here and then side.
Yes.
One or one more?
If the patient has more severe, then we can increase the point like here up. We can do up to here. If not, then we can just cover like 2 fingers.
Okay. In the middle and then one
Yeah.
or more.
Yeah.
Because also we can find it on this chart. Yeah, like
Yeah,
here.
of course. We can
Yes.
find it on the side.
Okay. Please show us.
Okay, we'll work on it first. So yeah, we can. We burn it, and we can see the heat is coming out. And to increase the more burn part, we can blow it. Yeah, and then we will like put it in a point. There are 3 ways of giving the heat to the patient. Like one is light burn, second is like middle burn, and third is the extreme burn.
Oh, so
Yes.
extreme, you just put
With the-
moksą on patient's body?
So some condition in ancient time, they used to put the direct moksa like this. This is like more, not the roll one, the open one. They make it more roll and directly touch here.
So
and
maybe
they
you can
burn.
show us later,
Yeah,
please.
we can
So,
do that.
Yeah.
And now I will do like first degree and less than that. And we will put that. Yeah. And if we have like S's, then we will put it down. Yeah, and we can hold it like this so that we can sense the heat as well as. And we will ask the patient, if you feel too much heat, just let me know. And we put it like this and wait for a moment until it gets warm.
So we are warming up the points,
Yes.
special points in the body.
Mhm.
Now for low back pain, it's
Yes,
kidney.
yes, mostly for the cold points. Yeah. Okay, if it is too hard, then we can just like giving a little pamper. Yeah, and then again we will go. We will do the same thing like either for 3 times or 5 times, or some more severe cold, we can do 7 times.
Okay, 3 times, 5
5
or
times,
7 times
Yeah.
on one point.
Yes.
And then going to another point.
Yes. Or even in the for extreme, if one more extreme, then we can do 21 times.
21 times.
Yeah.
If we really want to warm up this point
Yes.
and want to this heat going deeper
Deeper.
into
Yes.
inner organs.
Yes.
So of course, in this area, we can find kidney on both sides. One side,
Yeah.
and on the other side, there is a connection with some autonomic nervous system, like sympathetic.
Yeah.
So innervation coming from these points to inner organs.
Yeah.
So we can explain it from the Western point of view or from anatomy
Yes.
point of view. So Sowa Rigpa and Western medicine or just anatomy, so there's same, yeah? We can
Yes,
say.
same. It is also kind of little activation to those sympathetic nervous system as well as the heat.
Yes,
Yeah.
yes.
And after doing this, we can see in the patient's skin, it is a little bit more pinkish or reddish color, and this is also kind of good one.
It's a good sign
Yeah.
if it's more reddish.
That means we're giving like proper heat.
Okay, so you can see patients show us that there is hot.
Yeah.
So we are waiting 3, 5, or 7 times when he
Yes.
do, it's pain. Okay, I
And
like it.
After this, we move into the other point.
Okay, from the other side of the spine, yes.
And after giving the heat, then we have to cover them and we have to preserve the heat. Like if we keep it open, then we might can lose the heat and the heat cannot stay properly. So after putting the moksa, then we need to cover the properly and then we move into the other point.
Okay, but you cover this side and go with this side?
Yeah, just like. Yeah, and I can just up to this point and I can do here.
Okay, so it's better to cover this warm
Yes.
part that it will not cooling down so
Yeah.
fast. That's a good idea. How you say in Tibetan? Tsatsa?
Acha.
Atsa. This side is going faster.
Because the right side is more hot side, heat
Okay.
side, more sun side, and left side is more moon side. So left side they tend to have more cold energy, and the right side they tend to have more fire energy.
Fire energy, right side,
Yeah.
liver,
Yeah.
gallbladder, right side,
That's why
fire.
they get more heat in the right side
Ah,
first.
so it's easier. But is it like this that sometimes we just warm up left side of the body, or usually do it both sides same?
Yeah, sometimes patient they complain about the more problem in the left side, and then complain in the right side, and it's okay. We can just do on the left side.
Okay.
Yeah. It's just dust of the excess. Okay. So
And then you massage few times.
yeah, just like consoling them.
Just going, yeah.
Yeah.
Are you going right side or left side, or doesn't matter?
It's okay. You can just go clockwise.
Clockwise.
Yeah.
Okay.
And then we can move into the other point.
Now we go lower?
Yeah, lower.
Oh.
Just like 2 finger down.
Right side, also warm. Okay.
Maybe we skip now.
Yeah.
Then we go to the other left side.
Yeah. Left side, it's take more time.
Yes.
So on one session, you do how many points you can do?
It depends on the patient. Like if they only complains about the kidney problem, then we do just like 6. And like 6, or if we want to increase, then like 3 more here, like 3, 3, 6, 6, and 12 points. And if they wants to do over here, like in the lower back as well as, which can up to like 15 or 18, something like this.
Oh.
Yeah.
Okay, so we can do more points
Yes,
if it's
yes.
cold, really
Yeah.
cold patient.
Really cold. Some patients are really more Beken dominant and more cold, then we need to increase the heat as well as and the point.
So we can say patient who are small,
Mhm.
big,
Yeah.
and cold nature, swollen, and the back pain.
Yes.
Okay. What Sowa Rigpa can offer for people in stress or over stress or too much what? Wind, yes?
Yeah. Lung energy.
Lung energy.
Yeah. If the people we have with the more wind energy or more stress, we have like two external therapies, which is one oil application. We normally call it Ku-Nye, and other is Horme, which is Horgimecha.
So oil application, yes, warm
Yes,
oil.
yes.
So first and second is Horme.
Yeah, Horme,
Okay.
Horgimecha, which now I will show you. And the Horgimecha is, this is the herbal pouch. It is inside the pouch, there is a herbal compound. Mostly the main ingredient is jati, which is nutmeg.
Zati,
Yes,
nutmeg.
this
Okay.
really good to balance down the wind energy.
Okay,
Yes.
and how you use it?
And then we dip it in a hot well, and we dip it and put it in a points, especially when wind points to balance down and calm down. We put it over longer, like some 7 times or 21 times. We put it in some points, and then it helps to balance the wind energy.
To pacify
Yeah.
lung
Yes.
wind.
Mhm.
So first point, it's
Yes,
on
we
head.
have, yeah, on head. We have like 5 main gates, which is like crown point of the head, and 2 in the center of the palm, and
Okay.
2 in the center of the sole. And because they are lung person, so we can do in the first Tibetan vertebra as well,
Okay.
which is the lung point. And first we do in the crown head, because in the crown of the head there is one wind energy, which is like soxinling, life sustaining lung.
Okay,
It increases the wind energy, so when we put in the crown point first, it balances down the wind.
So also this helps for other wind in the body.
Yes, yes, yes.
So we can suggest to do massage, oil massage, or Horme the best
Yes.
for all people with stress, with
Yeah.
insomnia, with mind
Yeah.
running around.
Yes,
Okay.
yes, yes. If they do this is really best for them.
Okay. How to find this point?
So to find this point with the patient hand, like patient finger, we ask the patient to like from the
Measure.
here line here, we go 8 finger.
Okay.
8 finger up to the here, and the center point, it's the point of the crown head.
Okay.
Yeah. Or we can just find the like center of the here, like from the here, third eye, like here, and the center from the tip of the ear. If they cross, the cross
Okay.
section is the point.
Okay. I feel a little like tension here or pain. So it's this point?
Yes, sometimes when we press it down, yeah, we can feel little depression as well as some stress and some pain as well as that's the point.
Okay.
Yeah. So I will show you the Horme. So we need to dip the pouch of the Horme here in the oil, and then we check the temperature.
Because it's warm oil.
Yeah.
Yes.
And we check the temperature, and we will put it here on the point, and we can ask them if it is the good temperature for them or not. If it is too hot, then let us know. Is it the good temperature for you?
Hey, patient, don't
Yeah.
sleep.
Okay. And then again we go and dip here and put it in the here, and then we can just slightly remove it and like put the thumb here and to here like this. We warm up the point.
Okay, so we put Horme and then finger.
Yeah.
Form, and
then after some time, we can just keep it here, like let the heat flow from the point to the body.
And what patient should feel? Like releasing, relaxation?
Yes, some patients they feel like releasing of the wind energy, some because of the warmness of the herbs and the nature of the herbs, and they will feel relaxed and something is coming out. Yeah. Again,
I think it's good do Horme in the afternoon, just before going to bed, and it's easier to sleep and release after relax after whole day.
Yes.
Especially if you're stressing your work,
Yeah, that's good idea.
or with family, kids, and then you do Horme and
it's like a sleeping pill.
yeah, sleeping pills.
Yeah.
Yes.
We do it here, and after doing for several times, we can see the skin is a little bit pinkish or reddish, then that's the good amount or the standard point of doing the Horme. And then we can move into the other point.
So doing this 7 times, yeah? 5, 7.
7 or 21 times we can do that.
Okay.
And while doing this, even we can recite the mantra of medicine Buddha so that the treatments get more strong and they can get healed. Yeah. So when we recite the short mantra as well as yeah.
Anyway, saying mantra is good for our mind also. Yeah?
Yes.
Because mantra, it's mean
It's meant to hold or pacify your heart or mind.
because as I know, mantra, it's
Yeah.
man, it's mind,
Mind.
and tra, it's
To balance or hold it. Yeah.
So it's like mind protection. Yeah.
Yes,
Also, tra
mind
means
protection.
protection. Yeah.
Yes,
So
yes.
tantra is body protection, and mantra is mind
Mind
protection.
protection. Yeah.
So if we repeat mantras, so we protect our mind. And from the Western point of view, we just, works with our muscles, throat muscle, what is innervated through the parasympathetic nervous system, through vagus nerve. Yeah.
Yeah.
So it's good to use it. Yeah.
Yes,
Okay.
yes.
Okay. And so we can say, repeat something. We can balance our lung.
Lung.
Yes. Here and where else? You say.
Here in the center of the palm. Here.
May I will use it?
Yeah, of course you can.
Okay.
Yeah.
So we are going like this. Yes.
Yes.
Yeah.
Yeah.
If we don't have this, we can use just warm oil
Oil, and you can.
with nutmeg. It's good. Yeah, a little,
nutmeg is
just a
best
little.
for the wind balance.
Okay.
Yeah, lung.
So everybody can do massage before
Yeah.
going to bed like
Bed,
this, or
yeah.
foot massage.
We can do that.
So the
Oil.
best way to calm down your partner is doing foot massage with warm oil.
Yeah.
Yes? Or your kids just to
Yeah.
warm them up. Yeah. Okay. And what else? What kind of oil you use?
Mostly for the lung person, the sesame oil is the supreme one, and as a base oil.
Sesame oil.
Yes. And then if you have to add the essence oil, the nutmeg oil. Nutmeg oil is the we put 3 to 5 drops in 100 ml of sesame oil, and it's best for to balance the wind or the lung.
So you add nutmeg oil to sesame oil.
Yes.
But how to do nutmeg oil?
If you go around,
you can buy?
Yeah,
or you
we
can
can
mix
buy.
probably some special oil with nutmeg.
Yeah.
Okay.
Even the powder of the nutmegs or the smash, you smash it or just the nutmeg, you can soak it in a sesame oil, then it will absorb the essence of nutmeg, and it will be a nutmeg and sesame oil.
Okay.
Yeah.
So head.
The two center of the palm and the center of the sole.
Of the soul.
And
And
for
then some points if we know.
Yeah.
Okay.
And some cold point like Beken, we can do this as well as.
For here.
Yeah, because it is warm as well as, so it is good for lower back and some cold point as well as.
Okay. Okay. Thank you.